Dr. Khadija, welcome and good afternoon. Thank you so much for being here on the show. I very do much appreciate you and very grateful for you.
And thank you for inviting me.
My absolute pleasure, doctor. Doctor, for a starter, can you please introduce yourself? Who is Dr. Khadija and what do you do?
Yeah, so I am Dr. Khadija. I'm a specialist pediatrician, and I am a master's candidate in neurodevelopment, so child development. I currently work with Medcare, but I've been in multiple centers in the UAE. So I started off in government, and then I moved out to private. So I went to two different private hospitals and clinics, and now I'm with Medcare.
Wonderful.
And yes, and I'm a mom of three. So
Uh-huh.
lovely.
Doctor, I have a question. Why you chose to be a pediatrician in specific?
Yeah, that is a very good question. If I answer that honestly, it's the thing is with pediatrics, um, so while we're rotating during internships, we're basically going through different departments. So we go to obstetrics and gynecology, surgery, internal medicine, and pediatrics. Those are the big ones. So I think that I found the love for pediatrics because I promise you, as soon as these children feel better, you immediately see it. The face brightens up and they're happy and they're smiling. And to see that and to be able to be a part of that, I felt it really it hit close to my heart. And so I said, pediatrics it is, so to be able to see those smiles again, to be able to be a part of getting them better and maintaining their health, it was such a beautiful thing. And I think that's what drew me to pediatrics.
Wonderful. Does it make you fulfilled as a person?
It does. It does. It really does. And for very similar reasons. It's very fulfilling to be able to, when children come in, when they have high fevers, they're so tired, they're feeling sick. You can see it on their faces. They can't eat, they can't sleep, they can't play. I mean, this is what children do. This is the essence of their life. And when you give them the treatment, when they feel better, and then you see that on their faces, and you see it on the faces of the parents as well. I mean, this is their babies, right? And when you see it, it you see that immediate effect and that transition. It's very fulfilling when we see that smile, especially, and then we see them running around and playing, and then we know, okay, they're better. It's good. So definitely, I think as a parent as well, I feel it's something that it's very fulfilling for me because as a parent and to see other parents become happy when their child feels better again, it's a beautiful thing. We don't only work
Fascinating.
with the children, it's the families as well. So definitely.
Very beautiful. Doctor, how does, let's say, the child development plays a role as an adult? In
How
other
does, sorry?
words, for example, how much should we care for the grow up of the children? Like,
How much, sorry, you were cutting off a bit there.
in other words, sorry,
Yeah. Okay. Yes.
do you hear me now?
It's cutting off a bit. Can you repeat the question?
Sure. So, what big of a role does children's development play as they grow up? In other words, can we reverse things which we have missed in the development of the kids as they are kids when they grow up?
Eh, Sorry, the connection is not the best. So did you say how important is a child's development and can it Can anything be reversed as they get older?
Yes.
Okay. All right. So you mean if okay, so if we don't address, say, example, a child's development, and as they get older, there is a concern, can it be
Yes.
addressed?
Exactly.
Okay. So definitely. So the thing is that in the past, we used to say, you can't teach an old dog new tricks, right?
Mm-hmm.
So in the past, we always used to think that as children grow up to be adults, that nothing can change after that. Habits, behaviors, development concerns. They used to think that when you become an adult, nothing can change.
Mm-hmm.
Now it's a very different story. It is a very different story. So we have something called neuroplasticity.
Mm-hmm.
Okay, so neuroplasticity means that the brain can change either in structure or function, right? So what that means is that as we keep training the brain, that it can change in either its physical structure or the functions that it does. Say for adults who have strokes or who have some sort of brain damage, um, there are other areas of the brain which can take over the function of the area that was damaged.
Mm-hmm.
Also, when it comes to structural changes, neurons or the parts of the brain that transmit the electricity that gives us our functions or allows us to perform different functions, so that physical structure and those cells, you can generate new ones through
I
a
see.
learning process and through practice. And so that's what we call neurogenesis. So the production of new cells that will start to perform these new functions. So they'll increase in number, they will increase in size, they will increase in the connections that they make. So
Mm-hmm.
definitely, if there is a developmental concern, that if we work on it, see, early intervention is always the best. We get the best outcomes the earlier it is. But even if it occurs later on, it doesn't mean that nothing will change. With
Mm-hmm.
practice, the brain is like a muscle. With practice, with practice, with practice, you will form new connections. And so those connections will provide the functions that are necessary. So you're training the brain. And so definitely things can change.
Very beautiful. Doctor, something that usually I ask myself is, why do children have the capacity to learn faster or easier a new skill or a new language? Can I say that they have, let's say, better neuroplasticity or neurogenesis in this case?
Definitely.
Mm.
That is correct. So actually in the younger age group, so as a child is developing, especially before 3 years of age, the brain is rapidly growing. So
Mm.
with this rapid growth, the plasticity is more. Yes, as people get older, to change or the plasticity of it is less, but it's not completely gone. But definitely there are what we call the sensitive periods and the critical periods for different paths of development. So what I mean by this is say something like eyesight. Critical period of development for eyesight is actually just after birth. So
Mhm.
if a child is unable to see, for those first few months after birth, so for any reason, say they were born with, example, a cataract, and if they're unable to see for those first few months and it's not addressed, they can be blind for the rest of their life. So
Mm.
that was a critical period. When we talk about sensitive periods mean that so things like language development in the first 3 years is a sensitive time for language development. So language will develop rapidly during those first 3 years, and they can actually that's the highest period where they will pick up second languages as well or third
Mm.
languages. So it is a sensitive period. After that period, it becomes a little bit tougher to pick up, say, something like a second language, or you have to work a little bit harder to develop their language and communication skills.
I see. Thank you so much, doctor, for the explanation. So now the question is, how can we care the best way, let's say, to care for the development of the mind of children? How can we make them grow optimally, in a sense?
So, so how can a parent help their child's development?
Yes.
Okay. So now the thing is, it's you can always support your child's development, but if there is something that is going to affect the development, it will already be inherently there, right?
Mhm.
So by you not say say a parent not stimulating their child enough doesn't mean that they are the reason why their child is not developing. I just want to make
Mhm.
that clear first, right? Is that just because if you don't say, I'm going to tell you how to support your child's development, but if you don't do this, your child is going to be developmentally delayed. No, it doesn't mean that, right? Because it's an
Mhm.
inherent process that happens, part of genetics, part of brain development, etc. Right? So now, when it comes to supporting your child's development, definitely the more you stimulate your child, the faster they're going to catch on and the more easily they will catch on with different parts of their development. So, what parents can do at home is the first and foremost is developing or managing emotions and self regulation, right?
Mhm.
I find this the most important part of development because emotions and self regulation, meaning that you can regulate yourself when doing a task. For example, um, you know, your child is building blocks, okay,
Okay.
and the blocks falls over. Okay, now in order to self regulate, the child has to be able to reassess the situation, see what went wrong, and then start building again and to know that they're going to
Mhm.
reach their goal, right? That's the part of regulation. Now, when they dysregulate, which again is very common in the younger age groups, that they'll start crying and going on the floor and screaming, right? So when it comes to emotions and self-regulation, that's the first thing that I address with parents, and I always tell them that there are three most important times in a child's day, three most important times in a child's day. That is, as soon as they wake up, during the day, either they when they come back from school, or it's the second time that you see them in the middle of the day, and then just before they go to bed. So these
Mhm.
are the three most important times of a child's day when they need you, when they need to know that you're there and you need to meet them in their circle. You need to meet them in their space. So, what I mean by this is that when they wake up in the morning, as soon as they wake up, it's instruction, instruction, instruction. Get up, go, change, brush your teeth, have your
Yeah.
breakfast, get ready for school. Right? It's instructions, instructions, instructions. Right? Now, what I tell parents is that meet your child in their circle, meaning rather than waking them up with instructions, 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 that you give them that independence to follow a schedule themselves.
Mhm.
So create or provide either a verbal or a visual schedule. So you would actually have a schedule written or with pictures on it to show each step about how the child is going to get ready,
Mhm.
right? And so when the child wakes up, it's not you immediately in their face and go get this, go do this, go do. So I think that the dynamics between the child and the parent is sort of strained early in the morning. And if you incorporate something like a visual schedule to allow the child to have some independence in the morning to sort of wake up their brain slowly by themselves, it will really help to set the tone for the rest of the day. Okay. The
Mhm.
next part of it, the next part of it is when, when they come back from school, right? When they get back home, or in the middle of the day, the child is playing, you've done what you needed to do for the day, or you go to work, etc. Whatever the situation is, that middle time of the day, what you're gonna do is you're gonna meet your child in their circle as well. So what I mean by that is it's gonna be a playtime for you and your child,
Mhm.
but it's gonna be them telling you what you want, not you
Mhm.
telling them what they should do or what they shouldn't do. So, for example, instead of taking a piece of paper and say, "Let's draw," give your child an option. Would you like to play with the blocks or would you like to do some drawing?
Mhm.
Right? So by giving them this option, again, you're promoting independence and you're giving them that confidence to be able to make the decisions as well. And when they
Like giving
make
them
the
the ball, let's
decision,
say.
exactly, exactly. So you're handing that ball to them. The ball is in their court, and they can feel more confident about what they're doing, and they can regulate their emotions, saying that I am in control and I can be independent. Because as children get older, this is the part of development, right? So you will actually go into their circle and sit with them and do what they want. Now, I'm not saying you got to sit for hours at a time. Studies have shown that 10 minutes of
Mhm.
this interaction makes a big difference in a child's
Oh,
life. 10 minutes in the morning, 10 minutes in the afternoon, and 10 minutes before bedtime. And this is, listen, there's no maximum, there's only a minimum,
yeah.
okay? But 10 minutes of this interaction, because I mean, we live in a very modernized society, a very fast-paced life. So we've gotten to a sort of number. It's hard to put out numbers, but that number has been said, and so
Mhm.
10 minutes it is, just to sit and have that pure interaction with your child without the devices, without anything. Just be there, be present with your child, right? And then before bedtime. So before bedtime, I always tell parents, because I really encourage sleep hygiene as well. So what I mean
Mhm.
by that is no sugar 1 to 2 hours before bed. All the sugary stuff has a no screen time 1 hour before bed. 1 hour is the time where, say, if you want your child to go to bed at 9, you're gonna have to start your sleep process or your wind down process at 8. So 1 hour before that, and
Mhm.
that's when you're gonna start dimming the lights. And so that interaction in the evening can be anything you want. It can be you reading a book. It can be you just talking if your child is old enough to be verbal and discuss. So you would discuss the day, you would talk about what they want to talk about. And also with the books for the younger children, it's not even about actually reading the story. I always tell parents, why do you put this pressure on yourself to actually read the story? I mean,
Mm.
when you come with trying to go to bed and make a 3-year-old sleep, you really think they're listening to that entire story? They're not. They're really not. They're really just looking at the pictures, right? So I always tell parents, don't put pressure on yourself to read the story and finish the story and get angry when your child is not listening and they're fighting with you and you're trying to read the story and you're like, keep quiet. That's not what it's about. That's really not. It's about that connection that you're going to make with them at that time. So whether you want to make up a story, believe me, your 3-year-old is not gonna know that you're not reading that story properly. They get just, you can just look at the pictures and talk about the pictures, and that's it. You don't even have to actually read the story. And that engagement is actually more interesting for them when they have that back and forth rather than them just listening to you. Because some children really like to have that interaction, right?
Mm.
So this is the first part of development that I always encourage parents to do. Because if you have the emotional side of it, everything you do with your child after that is going to be a lot easier, right? If
Mm.
you have that connection with your child, any other part of development that you work on, you're going to have a good connection with your child and really understand your child. And it's about this process helps you to learn about your child. Oh, I have some parents like, I didn't even know that he likes puzzles until we sat and we tried it one day, right? So it's a process about learning about your child. And when you learn about your child, you use what they like and develop other parts of their development. So their fine motor skills, so the hand skills, the physical skills. You have to know if the child doesn't like what you're doing with them to try and develop their skills, they're never going to learn because they're not interested. And if you force
Mm.
them, that's going to be a whole other kettle of fish.
Actually, this is something that usually fascinates me. Why is it that kids always want to oppose their parents? Like, usually the parents have to play some tricks and, let's say, find a way to get the point that they want to deliver to the kids. So, why is that?
Right. So, yeah, it is a normal part of development, right? So, as a part of survival, the child wants to gain that independence. They want to do what they want to do. Now remember that the front part of the brain, which is our prefrontal cortex, this is the frontal
Hmm.
lobe, and then we have the prefrontal cortex. So that actually only starts to develop after 6 years of age. Okay, now that part of the brain really controls things like inhibition, our executive functions, etc. So when it comes to development of that front part of the brain, what we see in younger children when that part of the brain hasn't started developing yet is that they're not going to inhibit their responses to you. So if they like what you're doing, they're gonna go with it. If they don't want to do it, that's it. They're gonna tell you straight, we're not having it. I want to do something
Hmm.
else. I'm not in the mood for that, right? So I think when it comes to going, say, being rebellious against
Yeah.
parents, it's more about them not having that inhibition, or that social norm of having inhibition and being respectful and not backchatting and all of these things, right? That comes as part of the brain development later on, to have those inhibitions and to learn the social norms, right? And the cultural norms within that family. So that takes a bit of time. So yes, you do find that before the development of the prefrontal cortex, that children are a bit more rowdy
Hmm.
than as they get older.
Very interesting. Thank you so much, doctor, for this. One more thing now that I'm always wondering about: why is it that kids always seek the approval of the parents, like in a literal manner? Why is it so hard, for example, to break the word of a parent from a sense of a kid? We feel like this guilt if we said no
Mhm.
or if we oppose them compared to other people. Like, is there like a connection between a child and a parent that we, let's say, differentiates them from other in a sense?
Okay, so you mean the bond between a parent and a child?
Yeah,
It's looking for validation or approval from a
yeah.
parent. Okay, so now you're going into more of a very socially complex phenomena, right? So I promise you, this type of thing is very nuanced. Why? Because when it comes to seeking validation from a parent, it really depends on personality and the temperament of a
Mm,
child. So you would find that yes, some children, if you notice that some children will do something, and their parents will just look at them and then they'll stop. But then on the other hand, you have another child, probably in the same family, that would probably be doing the thing. The parent will look at them and they'll just continue on.
they just
It
don't care.
doesn't
Yeah,
faze them, it doesn't bother them. Exactly. And these are children from the same family. I'm sure you've seen, continuously on Instagram, that you would see the first child is very obedient and very quiet,
yeah.
and the second child is very rowdy and
Whatever.
dance whatever they want, they don't care, right? So it has a lot to do with personality and temperament, first and foremost. And then the second thing is that you won't be able to treat each child the same, no matter
Hmm.
how much you want to be able to maintain the same environment for all your children. If you have more than one child, more often than not, they're going to be treated slightly different, whether you're conscious or subconsciously doing things. You're never going to treat the child the same, and that's where you see the differences in one child being more quiet, looking for that approval for parents, and then you have another one who just is not having it and it doesn't matter to them, right? The other part of seeking validation or wanting to please your parents, again, it comes with the temperament of the child and the personality. You really have to, it's something inherent. And so this is why there's still research ongoing as to why children in the same household, in the same environment, still behave differently.
Yeah.
So I think, yeah, they still behave differently. And that's why I told you in the beginning that this is a very it's a very complex phenomena, which is still being researched as to why some do and why some don't. And the children that do, what is the environment that they are being exposed to that makes them feel like they need that validation? Is it
Mhm.
because the parent is more harsh in that sense that they they feel like, if my I don't want my parents, I don't want my mom or my dad to scream at me, so I'm just gonna do things that they like, so we maintain
Yeah. Peace.
the safe environment, right? The peace. We maintain the peace. And another part of it is that they seek validation because they do things, and then they want the parent to respond. Maybe the parent is not giving them the response they want usually, right? So say they want a medal and the parent is not very attentive to that. And so
Hmm.
they constantly work harder to try and get that validation.
I
And
see.
so they're looking for their parent to say well done, because as part of development as well, children seek approval from parents. And what I mean by that is that when they're playing with the toy, so when you see the young children playing with the toy, they'd actually turn around and look if the parent is looking, and that's that
Ah.
that they want that attention. So they would play with the toy, they would do something, they would press down and the light will come on, and they'll turn and they'll look at the parent, and the parent will
Oh.
clap, and the child will clap as well. And so this is sort of this is the beginning of it, is when the child does something and they get a response. That's the reward that they get. The
Hmm.
reward is the parent giving the attention and giving some sort of sign, like clapping of the hands, and say that's the reward for the child. And as you get older, that type of reward changes. So it's not
I see.
necessarily that they clap for you, but they say well done. And so that is a part of development, that if you don't give that approval or they don't feel that sense of reward, they're going to keep trying to seek that.
Mm. Thank you, doctor, for this. Very interesting and fascinating, actually. Doctor, let's talk about autism. What is autism?
Okay. So so autism is basically challenges in social communication. Okay.
Mhm.
And so there's a criteria for autism. Okay. But it's mainly based around social communication.
Mhm.
Okay, so when we talk about social communication, we have social challenges, we might have language and communication challenges as well. And so it is a neurodevelopmental condition. Okay.
Mhm.
So I don't like to use the word condition too much, because it's more of what we call a neurodivergence. So these are
Okay.
neurodivergent, right? So if when we talk about autism now, and if we go more with the neurodiversity movement, I don't know if you've heard of the neurodiversity movements,
No,
but
can you please tell me about it?
basically we're saying that every brain functions differently,
Mhm.
right? So we're still in a really early stage of the neurodiversity movement. So what neurodiversity is that we have neurodivergence and we have neurotypicals, right? So we have a majority who have typically developing brains.
Mhm.
Again, typically is not something that we want to, it's a bit of a misnomer when we say typically, right? Because then we're assuming there's a normal, right? But what
Mhm.
neurodiversity is that there's so many different functions of the brains and the ways in which the brains are wired. Okay. So now when we come back to autism falls under the neurodivergent, meaning that their brains are wired differently from what
Mhm.
we have assumed is typical, right? So the way in which the brain processes is different. Now, I can sit here and tell you the definition of autism and the therapies for autism, and right, but I really want to take this opportunity to tell you the other side of it,
Sure.
because I have been with people with lived experiences who are autistic individuals, and their lived experiences is so different from what you would read in a book or what you would be taught, say, in medical school. And so it's very different. Um, so, for example, empathy.
Mm-hmm.
So they say that individuals with autism don't have the function of empathy,
Mm-hmm.
so they don't understand the other person's feeling, basically. So they don't have that empathy. But I have met many individuals with autism who are very empathetic. They're
Mm-hmm.
very empathetic, and they actually, they take it close to their heart when something happens to someone else, you know? And so our idea about social communication challenges is actually not what we thought it was. So
Mm-hmm.
who brings up the idea about society? Who made the idea of what a social norm is? Who decided what's normal and what's not,
I
right?
don't know, us humans actually, but like I don't know based on what did we have decide this.
Exactly. Based on what did we decide that there are a particular set of norms or the way in which we're supposed to function in society? We decided it as a whole. We decided it as, yes, a majority, but we forgot about the minority. We forgot about the divergence,
Mm.
right? But now we see that there are a lot more individuals with with autism than we did before. Why? Because we're showing that it's more acceptable to not have to strictly fit by societal norms, to say that you need to do this in society and you need to behave like this and you need to do this. We're giving them the door to be able to be comfortable to live in society as anyone should be able to. Sorry, I am just going to,
Mm-hmm.
yes. Okay. So we're actually, with this, we're changing what the idea of a social norm is. Now, when it comes to language and communication, the language and communication side of it, yes, the brain is wired a little bit differently. And so some children and some even adults with autism have difficulty with language and communication, in that sometimes verbal communication or speaking is difficult. It's a challenge,
Mm.
right? And that's when we first start to see most of the autistic individuals who before diagnosis um, come with a language delay. So they do
I
come in
see.
with a language delay, and so that is the first step into why they're seeking help, is because, okay,
Mm-hmm.
my child hasn't started speaking yet. And then as we move through the assessment process, we find the different features related to autism. And when it comes to language and communication, even this is something that we have to understand, that verbal or speaking is not the only way to communicate. We
Mm-hmm.
have some individuals with autism who do have language and communication challenges. We sometimes use things like the PACS system, which is the picture exchange communication, where we use pictures and they can point to the pictures and then ask for what they want. Or they take the line, so I want, there's the I want, and then they
Oh,
would choose the picture and put it up there and say, so I want, say they pick a picture of water and they will put the
yeah.
water there. And so, right? Um, Also, uh, the other thing is sign language. So sign language is something also that we sometimes incorporate for language challenges for individuals with autism. So as you can see, there's a diverse way of to communicate. And so this is the beautiful thing. This is the advancement in neurodevelopment, is that we're starting to understand that even individuals with autism are able to communicate. It might not be in the traditional way, but we're still there are still many ways to communicate. I recently attended a conference with an autistic individual who was non-speaking, and he gave the lecture. So actually they pre-recorded it, and he
Mm-hmm.
actually types out he types out um anything that he has to communicate. It's typed out and then it's read out by the computer. So
Oh,
AI is going to help us so much, and it's going to open up language and communication for us, and for individuals with autism. And that's another thing that we're gonna go deeper into, is how to use AI to support language and communication in that way. And another very misleading um, idea about autism is that if they're non-speaking, that they're non-thinking,
mm.
which, yes. So if somebody is unable, so in society, we have this idea that if somebody is not able to talk and to speak and to tell us and to be intellectual about their conversation, that they're not really thinking, or they don't have any ideas, or they have nothing to say, or nothing is going
Oh,
on in their head, right? Isn't that what society does? Isn't
very
that,
true,
you
very
know,
true.
right? It means that if you can't talk, you're probably not thinking, right?
Mm-hmm.
But this is completely wrong. This is completely wrong. And as I mentioned, an autistic individual typing out, he's actually a professor, but he's non-speaking. He can read, he can write, but that connection between the brain and actually verbalizing and speaking, there is a wiring issue there. And so it doesn't mean that they're not thinking, or there's no ideas there, or they can't put anything together, or they're not intelligent. They actually have nothing to do with each other. Speaking and intelligence, nothing to do with each other. And that's the message that we're trying to pass on to society and to parents of children with autism, because the first thing they come in and say is, will my child be able to go to a normal school? But why do you want your child to go to a normal school? What's your idea behind that? Well,
Yeah.
because they won't be able to do anything. Math, English, they won't be able to do anything because they're not even speaking. So
Okay.
you see how that connection was made, is that if you have nothing to say to me, you have nothing on going upstairs. So, and I think that's one of the things that we're really changing when it comes to autism. And um, yeah, it's really, when I was going through this in the masters, and I I had autistic individuals with me and around me, and I was just amazed because some of them, yes, they don't speak, but they have a lot to say.
Mm.
You see what I mean?
Yeah, yeah. It's
So
not like
not being able
because
to
they can't
see.
speak that they can't think, in a sense.
Exactly. And it's just a really amazing thing about how we thought about things in the past and how we're going to move forward and think about them now. You really have to be able to have an open mind about these things, to be able to make it acceptable, and to be able to incorporate and what we call truly be inclusive in society, because we can't be inclusive if we're not open-minded about things. We can't include everyone if we're not open-minded about things.
I see. Doctor, what can, let's say, suppress the development of the brain, in a sense? And by that, I mean, because recently I've read, I don't know if you remember, but throughout COVID and the vaccination and so, some people had the concern of
Yeah.
vaccinations and autism and how does it suppress the development of the brain. Does that have anything
Yes.
to do with vaccination? Is that true?
So actually, there has not been any solid evidence yet to show that the vaccine has had any effect on a child's development.
Hmm.
What it actually is, what happens here is you correlate things. What happens in this case is that not the vaccine and not COVID, but the circumstances in which everything occurred is overlapping. What I mean by this is that giving the vaccine may not have affected the child's development. Getting COVID may not have affected the child's development. Being in isolation can affect a child's development,
Oh.
right? Right? So because of all of these overlapping um, variables of having vaccine, of having COVID, of having, the lockdown, all of these variables, it makes it very hard to say that which one is the actual
Hmm.
cause of, say, increase in developmental delays that we may be seeing. Because we know that isolation, if there is isolation of a child and you're stuck in four walls and there was a lot of tension between families as well within the household with the lockdown, a lot of frustration, a lot of anger, jobs being lost. There were so many confounding variables here
Hmm.
that you couldn't pinpoint one thing. And so all of that can affect a child's development. Stress, neglect, poor nutrition, right? Isolation, not necessarily physical traumas, but mental traumas as well. The screaming, the shouting, the crying, right? There were a lot of emotions running high during that time as well. People were dying as well. Families were being separated. It was a very difficult time. And that does sometimes go down onto the children, and that can affect a child's development. A child can regress in this way. So this is why that there is no solid evidence that any of this is related to the vaccine or to even COVID itself. And because it's still actually COVID, 3 or 4 years is not enough time to say for sure that
Conclusively.
COVID had created any changes, right? It's
I see.
very
I see your point.
recent, right? We only know very few things about what it changed, such as affecting the nerves for the sense of smell, for example, or affecting the part of the brain for sense of smell. That's the only thing that we've been able to correlate so far because it's so obvious. But when it comes to child development, it's not that obvious. It's not
I see.
obvious enough.
I see. I think it's because of the lack of the time and the correlation of different events that we, for example, concluded that maybe the vaccination is what's playing a role in the suppression of the development of the brain.
The children, exactly.
Yes,
That's the thing,
I see.
but we generally do that. It's human nature to do that, to want to find a reason, right? So, and that's what tends to happen. But sometimes it's sometimes very dangerous to come to certain conclusions,
Conclusions. Yeah.
right?
Doctor,
Yeah.
as kids, like for example, as adults, there are some certain supplements that people usually supplement with, like vitamin D, magnesium, because they are like
Mhm.
have some deficiencies in it. Do kids have this tendency that, or in other words, as parents, should they supplement their kids with certain supplements?
Right. So this is actually a very common question I get asked by parents. Does my child need supplementation? Now, to answer very broadly, no. Now, the thing is that a child should get everything they need from the food that they eat.
Hmm.
So if they're following, um, if they're eating all the food groups, they should be able to get all the vitamins and minerals they need for the daily amount that they need from the food that they eat. The only thing we do supplement is vitamin D. Yes,
Hmm.
because especially in this region, vitamin D deficiency is at a very high rate. It's about, the further away you go from the equator and the way in which the rays are different here, even skin color affects absorption of vitamin D.
Oh,
So in this way, we give vitamin D because a lot of the time the mothers are vitamin D deficient. And so when the babies are born, they're vitamin D deficient as well. So we do
oh,
supplement from the time a baby is born, we supplement with vitamin D up until 1 year of age. And that's the only vitamin that we actually supplement routinely. All other vitamins we don't. Now, the indications for a child to need supplementation would be things like picky eating. So we know that they're not getting their daily requirements, but that takes a lot of history taking. We have to be sure. So we take a full diet history and then we see what exactly they're eating, the amount that they're eating, and would that be enough for their recommended daily allowances for the main vitamins and minerals? Is it enough or not? If we see that it's not enough, then we go ahead and supplement them with multivitamins. The other thing is that if they come with symptoms, so when a child starts having symptoms of, a child is not supposed to be tired. In any point in time, a child is active. They should not be tired. They should not be getting easily tired while playing. And these are the main things we look for. The other thing we look for is pain. If a child is having
Mm.
excessive pain, especially say in the legs, in the bones, especially at night, we tend to look
Mm.
for vitamin D deficiencies in this case, and even iron deficiencies. So these are the main ones. When we see, when children have,
Black eyes.
the bottom part of the eye, exactly, there's venous pooling under the eye and it's a little dark. Actually, children are not supposed to have that. So is it because of allergies? Sometimes allergies can cause it. Sometimes iron deficiencies can cause it as
Mm.
well. So we have to go deep into the history before we consider supplementations. Now, the other part of supplementation is parents giving supplementation to help to sleep better. So we know that melatonin and magnesium are used to help to to help go to sleep and stay asleep, right?
Uh-huh.
Now, when it comes to a supplementation with melatonin, we have to be careful because again, there are no long-term studies with melatonin. So in growing children, we worry about the hormonal effects later on in life or when they reach puberty. So this is why we always advise parents to take melatonin under the supervision of a doctor so that the dose is maintained, and once sleep has improved, that we can start to stop it. Start to we can start to taper it off and
Yeah.
stop it. Um, in neurodevelopment, so in autism and ADHD, melatonin can be very helpful because they do have a lot of them do have sleep disturbances. So under our supervision, we do sometimes recommend melatonin for these children because we found that especially in ADHD, we found that it induces sleep faster and keeps the child asleep longer. So we found that it's 30-30. So we found that 30 minutes faster that the child will fall asleep and keeps the child asleep for an additional 30 minutes so far. So in these cases, melatonin is indicated in a child without a neurodevelopmental condition or without anything. There is no evidence to say that things like melatonin will work because if you
Uh,
don't have a deficiency, giving the supplement will not do anything except probably cause an overdose, right? Magnesium is another one. Magnesium is fine. Again, always speak to your healthcare provider when giving your children any medications.
sure.
Magnesium does help to relax. It relaxes the blood vessels as well. It causes muscle relaxation and so promotes sleep.
Interesting. Doctor, why did you mention that, for example, if they are vitamin D deficient, that it usually flares up that at night they have some feet pain or bone pain? Why at night?
Right? Okay. So now the thing is that the body is actually there is part of the REM sleep. So you have non-REM sleep and REM sleep. So REM sleep is rapid eye movement sleep. And during this part of sleep, the body is recovering and growing. So
Mm.
during this time, the growth factors are being released. During this time, the proteins in the body that support immunity and build immunity are being released, and so helps and aids recovery. So what happens is that the growth factors that are being released during sleep are actually causing the bones to grow. And that growing pain and not having enough vitamins,
Mm,
calcium, vitamin D, phosphate, to be able to build bones is not there. So that
I
will
see, I
create
see.
a strain, right?
Very interesting, actually. I never knew about that. Um, Fascinating, actually. Like at night, we need the vitamin D the most for the growth of the bones. Thank you for that, doctor.
Definitely, the growth of everything, the growth of the brains, that's when you consolidate memories as well. Everything you learned in the day is going to be
Mm,
consolidated when you sleep. So, this is why if you don't sleep, your immune system drops, you feel very foggy, you can't think, you can't remember what you did the last day. So,
true.
that's the thing. Sleep is so important.
Fascinating. Doctor, I can speak for hours and hours with you about all these topics. It's super interesting, actually. Doctor, is there anything that you would like to close up the episode with from your experience as a doctor in your field and as a pediatrician? Let's say an advice for the parents to help them on the development of their kids. Let's say as precautionary measures for them.
Mhm. So, the most important thing is that if there's anything I leave parents with is that I know that we tell parents don't compare your child to other children, okay? But I'm going to put a spin on this. I'm going to say, okay, fine. This is how you identify, right? That there might be something wrong. So rather than just using that information of comparing your child and feeling bad about it, that my child is not growing, use that information, empower yourself to use that information of, wait, my child, there's something wrong, my child is not growing as well as the other child. So use that to empowering yourself and speak for you and your child, and tell your healthcare provider, tell your family physicians, tell someone about it, ask the questions, right? So if you notice that there is something wrong, you've compared, you've said, okay, listen, my child is not growing like the other children, there's
Mm,
something going on, don't keep it to yourself. Raise the concern, raise it and say something, because I've had parents who wait and they say, no, 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 you know what, they're going to catch up, it's fine, let's just wait. If you have, and then we reach a point where we've reached a border where, if you came a little bit earlier, it would have been a bit better. We could have,
mm,
supported earlier and so have better outcomes. But again, it doesn't change that they will receive support, etc. But I need parents to speak for their children. If somebody tells you, you know what, there's nothing wrong, just relax, just give it. If they don't give you an explanation, if the person that you have raised this concern to, any doctor, any therapist, anything at all, if you have raised this concern and they are dismissive about it, do not keep quiet. Keep asking the questions. There
mm,
is always a reason why. So if your child is not saying any words by 13 months. Okay, say your child hasn't started saying any words by 13 months. Um, if your doctor just tells you, you know what, let's just wait, give it some time, ask why. Why should I wait? Shouldn't my child be talking by now? Actually, there is an explanation for that. Yes, because development is dynamic, and we should have by 18 months, so we have borders. By 18 months, we'll have 15 words. So that's the reason I'm telling you to wait, right? Because
mm,
we have the borders and you haven't reached that yet. We want to give your child some time, but you can do this. So you've given your problem. That the first thing is, you've given the problem, they were dismissive. Don't keep quiet about it. Ask why. Always ask why. There should be an explanation for everything. The second thing is that if you've given a problem but they haven't given you a solution, that's a problem in itself, because they are
mm.
supposed to give you a solution. Because you, as a parent, do not have the tools to be able to help your child, but that person sitting
Correct.
in front of you should have the tools to give you to help your child, right? So if there's anything that I can say to parents, it's be empowered. Your child can't speak for themselves, and you are the one to speak for them. So whether it's a health concern or a developmental concern, speak up for your child. Do not let anyone dismiss you, because you are the caregiver and you know your child best. And I always tell parents this, that you know your child best. If you come and tell me my child is having stomach pain, but I can't feel anything, I can't say there's nothing there, because that parent has come to me because they're worried, because they're concerned, and they know their child best. So you are your child's voice. So you need to be their advocate. So that's, if I leave parents with anything, it is that.
Thank you so much, Dr. Khadija. Thanks so much, Doctor, for the information that you presented today and the advice that you just presented as well for the parents. I wish you all the best
Thank you
and
so much.
nothing but happiness.
Thank you so much.
And yeah, thank you, Doctor. I
Thank
wish to
you.
see you
You
again in the
too.
future.
Thank you. Inshallah, yes. We will. We can talk hours. This is the thing.
We can talk hours, actually, yeah. Like I had many questions crossing my
Yes,
mind, like while we were talking. And I was like writing
right.
them
And
as a
maybe
notes
we
over
can
here
address
next to
them in
me.
the future. Excellent. So maybe we can address them in a future session.
Sure, 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 Doctor.
All
Thank you so
right.
much,
Well,
and I'll
you
see you in the
take care.
future.
Thank you so much. See you.
Ciao.